Hello and welcome to Medicare Speaking. I am Pragati Singh and you're watching NewsX. It's Women's Day, and on this special segment, we are discussing health, which is mostly neglected or hardly talked about. And to touch some of these issues, I have with me Dr. Ritu Sethi. She is Senior Consultant Gynecology from Cloud9 Hospital and Apex Clinic, Gurgaon. Welcome, ma'am.
Yeah, thank you so much for your kind introduction. Happy Women's Day to all my viewers. And let's hope our women remain healthy because they are the center of the family. And, so if a woman is healthy, the entire family is definitely going to be healthy.
Yes, ma'am. Ma'am, so without spending another minute, my first question to you is that these days many women come up with the issue like I am not getting my periods properly or just getting spotting, not proper blood flow. So please help us understand what is the main reason behind these periods scanty and how
Okay,
to
now
deal with
that's a very
this.
Okay, yeah, that's a very good question and a very pertinent question which you have asked me because these days I'm seeing a lot of women having menstrual irregularities. It's not just scanty menses, it can be infrequent, irregular menstruation, very heavy menstruation, menstruation not stopping at all despite medication, or menses not coming at all. So, the most important cause for this is our hormonal issues, which have to be thoroughly looked into, which have to be thoroughly investigated. So, what
Yes.
exactly are the hormonal issues, which we can expect in women who are menstruating? First of all, the most common is PCOD. Now, PCOD is, I would say a hormonal problem which has become very, very common nowadays. And I would rather say it's a new pandemic. The main reason for this is that a lifestyle, PCOD is basically a lifestyle problem. Usually PCOD arises in case the woman's lifestyle and her diet goes for a toss. So that is the most common reason for problems of PCOD. And in PCOD, exactly what happens is that because of the abnormal hormones, because of your lifestyle, because of your diet, your hormones go for a toss. The ovaries start getting heavier, they start getting bulkier, because of which the menses stop coming, or they might become very scanty, or on the other hand they might be very heavy or very frequent also. So that PCOD is one cause for menstrual problems. Another very important cause is thyroid issues, which again are
Hmm.
very common. Thyroid issues can sometimes be genetically there, or thyroid issues might just crop up suddenly and with menstrual issues, or maybe the woman reports increased weight gain or weight loss along with menstrual problems. So thyroid issues is the second most common, and third can be other hormonal problems like prolactin issues, or ovarian issues, or some kind of cyst in the ovaries, which can even lead to scanty periods. So mostly these are the most common causes of menstrual irregularities, which can manifest in many ways, and they need to be thoroughly investigated, thoroughly looked into.
Yes, ma'am. While talking about periods, and as you said, PCOD, thyroid, and these things, like PCOD and PCOS are so common these days, and the way the graph is increasing, like 1 out of every 10 women is facing this PCOD or PCOS. Ma'am, how different PCOD is from PCOS?
Yeah, first of all, I would like to just bring to your notice that it's not just 1 in 10 women. The frequency is much more than that. Rather, I would
Okay.
say 4 out of every 10 women are having PCOD nowadays. It has become so common. Women
Hmm.
coming with menstrual problems, the most common reason would be PCOD. Now, again, a very, very good question, very relevant question is, how is PCOD different from PCOS? See, in PCOD, it's only the ovaries which are getting affected. The patient might
Hmm.
not even be coming with any kind of complaints. It is just an incidental finding on an ultrasound which might be there. Whereas in the case of PCOS, it is a typical spectrum. It is not just menstrual irregularities. It can be hair growth on the face. It can be excessive weight gain. It can be full blown acne. It can be loss of hair from the scalp. It can be pre-diabetes, or it can even be inability to conceive. So it is an entire spectrum. That is why it is called polycystic ovarian syndrome. It's not just one problem. There are many problems along in PCOS, and these are basically hormonal issues which need to be again thoroughly looked into and treated. Every woman should be the time you will take medication, your PCOS symptoms are going to be in check. But once you stop the medication, the PCOS problem is going to come back to you. Unless your diet and your lifestyle are thoroughly, are actually you're strictly following a good diet, you're strictly following a good, I would say, lifestyle, only then this PCOD, PCOS problem is going to be under control.
Yes, ma'am. Ma'am, apart from PCOD and PCOS, there's very pertinent situation, which is like a sanitation and hygiene. Maintenance of sanitation and hygiene in today's time is one of the major problem faced by women, especially those who are working and traveling. So, what are the practical ways by which we can maintain our personal hygiene?
Yeah, okay. Yes, very important for every woman to know is, first of all, maintaining good menstrual hygiene is a must for every woman. How do you maintain good menstrual hygiene? Make sure that you are, it's the awareness basically which is very important. Menstrual hygiene is a
Hmm.
topic which has actually been swept under the carpet because people are so embarrassed talking about it.
Yeah,
Even if you go to a roadside, even if you go to a shop and you try and buy menstrual products, the probably in hush hush tones they would just kind of sneak it out and give it to you and not just talk about it openly. So one
yeah,
thing is very important, so that we have to be very open about these kind of things. And nowadays obviously things are becoming better, but still they are not as people are not as open talking about it as they should be. That's one thing.
yeah. They wrap
Second,
the napkins in newspaper and or in a black polythene or these things while giving you.
absolutely. So that is not the way, it is basically it's a woman's dignity. So it's
Yeah.
very important to maintain, to give equal emphasis on maintaining a good, healthy lifestyle. These products are as important as other products. If
Hmm.
you're going to a shop and buying any medication, this is as important and as relevant for a lady as anything else would be. She's considered impure in those 3 4 days. So these kind of things are which society really has to start talking about, not treat it like a taboo subject, or not treat it like isolate the woman once the menstrual cycle and menstruation is happening. Now talking about hygiene, all women should have access to menstrual hygiene products. They should be changed frequently, and those who cannot use disposable napkins should be provided cloth which can be washed and dried and used appropriately. That is one thing in which every lady should be maintaining good hygiene. Secondly, using products which are more of advertising products, I usually don't recommend them. I usually tell all my patients that just maintain good hygiene. So how you're going to do it? Keep the area clean, clean it twice a day, keep it dry, change your
Hmm.
underclothes at least twice a day. Okay, again, very important. And please try and dry your underclothes in the hot sun, or just
Hmm.
in India, there is no problem of not having enough sun anywhere in India.
Yeah.
It's basically, but because the problem of humidity is there, that is why
Hmm.
a lady ends up having so much of vaginal infections. But in case you are good with your hygiene, one, a lady will never have any kind of hygiene related issues if you are kind of very I would say active, proactive about keeping good hygiene, changing your clothes, not wearing synthetic stuff. This is what is very important to prevent any kind of infections or itching or any kind of abnormal discharge.
Talking about sanitary napkins. Basically, sanitary napkins are very common thing, but tampon and menstrual cups are still making their place in Indian market. And there are so many myths surrounding these, like tampons release toxins which can be lethal, and considering cups, they might get lost inside vagina. So please help us understand about the reality of these things.
Okay, now see, one thing is very good that these, I would say devices are available because they're very convenient. A sanitary
Hmm.
napkin has a lot of drawbacks. First of all,
Yeah.
physical activity is something which is totally restricted. For women who are used to doing good physical activity, for them, 3 to 4 days are totally lost. Again, sometimes the napkin tends to leak. Sometimes
Hmm.
there's a lot of discomfort, kind of using it. And some people also might be feeling a little I would say, embarrassed by the odors which might be coming from the napkin. These are the
Mm.
common, at the moment I know these kind of issues are mostly, faced by most women. So
Yeah.
tampons and menstrual cups are an excellent solution. Now, see, toxins are not released by the tampon, mind you. This is a
Yeah.
question which I have been answering, day in and day out. Especially today, I have been bombarded with calls saying that are tampons releasing toxins? No, tampons don't release toxins, but tampons usually, if they are left, for a longer time, they tend to cause infections, and one of these infections is toxic shock syndrome. I should
Mm.
that is just a medical terminology. Now, why I have used this toxic shock syndrome, I would say, word, because that is the problem which is happening in case a tampon is left inside. Now, most people would get very horrified saying, ki, oh my God, matlab, is it something poisonous? Because you are
Mm.
using the word toxin. But no,
Yeah.
no, it's just the bacteria which are growing in the tampon tend to
Mm.
release a lot of inflammatory products, which can lead to lot of infections. But for this, the only thing which you can do is to change the tampon every frequent hours. Like, I
Mm.
get many patients who have forgotten the tampon is just left like that for a few days and they've just forgotten about it. So they just come
Mm.
running to me, the doctor, in a state of panic, the doctor, am I going to get end up having toxins in my body? So
Mm.
just remember to remove it within a particular span of time, and you will never have a problem. That's one thing. Secondly, regarding the menstrual cups, the menstrual cups again are something which I think they are really convenient to use, because
Mm.
you just insert it inside and it collects the blood. It doesn't
Yes.
absorb the blood. So
Mm.
after a few hours, you simply remove it, rinse it with tap
Mm.
water, and reinsert it. There is no
Yeah.
question of a menstrual cup getting lost. Why?
Yeah.
Because there is no place where it, except for the vagina.
Mm.
So because there
Exactly.
is no other place where it can go, so there is no question of a menstrual cup getting lost inside, and it's very convenient to use. And secondly, I would say very convenient, because simply rinse it, put it back inside, and
Mm.
once you are through with your cycle, you can simply clean it properly. No, even not even used to use a proper sterilizer for the menstrual cup. Just put it in boiling
Mm.
water, take it out,
Mm.
wrap it in a cloth, airy cloth,
Mm.
and just keep
Mm.
it and use it
Yeah.
for your next period. So one
Mm.
menstrual cup can be used for years together.
Yeah.
And more are getting very, kind of comfortable with the product. Only thing is, which product, which size, which is going to suit you, this your gynecologist is going to tell you.
Mm.
No, now see, the menstrual cup is something which you just insert inside, take it out, rinse it with tap water, put it,
Mm.
reuse it, and then once you are through with your menstrual cycle, just boil it, put it in boiling water, and keep it in an airy bag and use it, keep it for your next cycle. So one
Mm.
menstrual cup can be used for years together
Mm. It's cost
without the
effective
quality,
also.
very cost effective, and besides that, without the quality or any product getting, kind of compromised. And again,
Mm.
no problem of foul smelling odors, no restriction on physical activity, no restriction on physical activity, no restriction on those things you have to take care of. So there is no chance of any leakage or anything happening. So
Yes. Yes.
these are good options which are present for
Mm.
women these days.
And it is eco-friendly also at the same time.
Yes, yes, absolutely. Very, very, very eco-friendly.
Yeah. So, as wrapping up this conversation, my last question to you is considering women health, there's one very important but yet very less talked about topic is vaginal, vaginism. No, sorry, it's vaginismus.
Okay.
It's
Okay.
topic vaginismus. What exactly this means and how one can seek help and relief for the same.
Okay. Now, see, vaginismus is something which I would say it's a very subjective thing, subjective
Hmm.
in the sense that it is not something for one person. What might be vaginismus for another person, it might be something which they are very comfortable with. So
Hmm.
kind of this kind of contraction of the vaginal muscle, especially during intercourse, is something which is very subjective for a woman. Okay.
Mm,
And there is no particular reason behind it. Why I'm saying
mm,
this, there's no particular reason behind it, is because there might be psychological issues involved
mm,
in it. She might not be comfortable with her partner. Okay, that's one
mm,
thing. There might be certain incidents in the past related
mm,
to this itself, which might be kind of evoking bad memories, or them, and or even in India, there is some kind of stigma also, I would say. So
mm, yeah.
mostly that fear in the mind of pain is something which most women are actually very scared about, because whatever
Mm,
information women tend to gather is through their friends. They don't come out for professional help. So
yeah.
whenever
Or
they
maybe
come to
Google.
us for professional help, yes,
Mm.
maybe Google, which is going to come up with thousand and one
So many
solutions for
answers.
everything.
Yeah. Mm,
Yes, just sit down. I usually tend to sit down with seen that the problem is not it doesn't increase to an extent that she has to be referred for psychological help. Usually the
mm,
solution is found out then and there at that meeting itself. And after
mm,
that, patients are very comfortable. I would say that they really don't need to come back to me, and they say, no, we are okay with it. And whatever doubts and all we have, they have been sorted out, and everything is going fine. So for this kind of an issue, I just request all women that in case you're having any gynecological issues, especially vaginismus, don't be embarrassed. Seek help,
mm,
seek a professional's help, because I think nobody better than a doctor to help you out with your queries,
yeah,
because we
right.
tend to take a very sympathetic, empathetic view of the entire matter, and we would not be treating it like a disease. We would probably be
Mm,
thinking about the other problems running through a lady's mind.
mm,
It's
mm.
important to come down and relate to the patient's problem.
Yeah. So
So
basically, ma'am, you are
that's
saying. So basically,
that
vaginismus is nothing to do with the vagina, but the psychological factors.
absolutely,
Yeah.
absolutely.
Thank you so much for this riveting conversation. I hope this was helpful for our viewers. Thank you so much, ma'am, for your time. We wish all the women out there very happy Women's Day. And for more videos like this, please do follow our YouTube channel and visit our website medicallyspeaking.in and Insta, Twitter, Facebook, and Q. Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.